Okay students, in the last session we have studied about the abnormalities in urine. Okay, now we'll talk about disorders of kidney. Okay, so firstly we'll discuss what is diabetes insipidus. Okay, don't get confused between diabetes mellitus and diabetes insipidus. Diabetes mellitus में क्या होता है? Due to deficiency of insulin, blood glucose level becomes high. Okay, wherein diabetes insipidus is the condition wherein there is deficiency of ADH, anti-diuretic hormone. Okay, anti-diuretic hormone का डेफिशिएंसी हो गया तो डेफिनेटली देर विल बी नो प्रॉपर रीअब्जॉर्प्शन ऑफ वाटर. मैक्सिमम रीअब्जॉर्प्शन ऑफ वाटर टेक्स प्लेस इन DCT एंड कलेक्टिंग डक्ट ऑफ नेफ्रॉन. बराबर. सो मैक्सिमम रीअब्जॉर्प्शन किसकी वजह से होता है? ड्यू टू सिक्रेशन ऑफ एंटी डायूरेटिक हार्मोन. एंटी डायूरेटिक हार्मोन brings about conditional reabsorption of water from DCT and collecting duct. Okay, अगर ADH का deficiency हो गया, if there is deficiency of anti-diuretic hormone, what will happen? There will be much more urine present in the much more water present in the urine. Why much more water will be excreted out in the urine? Because ADH का deficiency है तो ज़्यादा reabsorption होगा नहीं water का tubule में से and more water loss will be there from the body. So but obvious क्या symptoms रहेंगे ये disease का? ज़्यादा water loss हो रहा है means hypotonic urine will be excreted out by these individuals. Similar way ज़्यादा water loss हो रहा है so person will feel thirsty very often. So very often he will feel thirsty. So ये condition को क्या बोलेंगे? Polydipsia. What is polydipsia? Polydipsia means increased thirst. Fine. Then urine volume डायबिटीज़ इंसिपिडस में यूरिन वॉल्यूम बहुत ज़्यादा रहता है. हाइपोटोनिक यूरिन आई टोल्ड यू. दैट मीन्स हाउ मच अमाउंट ऑफ यूरिन इज रिलीज्ड पर डे? 10 to 15 लीटर ऑफ यूरिन. एंड नॉर्मल क्वांटिटी मैंने आपको बोला था 1.2 to 1.8 लीटर्स पर डे. तो देखो कितना एक्सेस में यूरिन एक्सक्रीट हो रहा है. सो एवरी टाइम दैट पर्सन will feel for urination. Okay, got it? So person keep on drinking water as well as there is much more urination also because of hypotonic urine. Okay, so urine volume बढ़ जाता है. Then polydipsia, excess thirst, dehydration, more of water is lost through urine and hypokalemia. Hypo means less. Kalemia is the word for potassium ions. So potassium ions are also lost in excess amount. So loss of more of potassium ions. So there will be imbalance in the pH of the body fluid also because of this. Okay, so ADH के deficiency की वजह से, ADH को दूसरा नाम क्या है? वासोप्रेसिन. वासोप्रेसिन का deficiency की वजह से it will affect the reabsorption of water and more amount of water will be lost from the body. Hypotonic urine will be excreted out. Almost 10 to 15 liter of urine is excreted out per day. Okay, and person will feel thirsty very often and this is known as polydipsia condition. Dehydration and hypokalemia. Hypokalemia means less potassium ions will be released. Okay, got it? So that is about diabetes insipidus. So remember, diabetes insipidus is caused due to deficiency of anti-diuretic hormone or vasopressin. Okay, and diabetes mellitus is because of deficiency of insulin. Now we'll move to the second disorder, that is nephritis. ओके, नेफ्राइटिस में क्या होता है? देर इज इन्फ्लेमेशन ऑफ द नेफ्रॉन्स. नेफ्रॉन का अगर इन्फ्लेमेशन हो गया, वेरियस पार्ट्स ऑफ नेफ्रॉन, नॉट होल नेफ्रॉन, समटाइम्स अगर नेफ्राइटिस का सिवियरिटी कम है तो पीसीटी विल ओनली स्वेल, okay, and if the severity of nephritis is more, then PCT, loop of elasticity, all the tubules of the nephron will be swollen, okay. So nephritis में क्या होता है, inflammation of various parts of the nephron, because of which the large size plasma protein will also get filtered from the blood plasma which is present in the glomerular capillaries, okay. So albuminuria हो सकता है if the person is having nephritis, okay. So nephritis अगर रहेगा तो albuminuria होता है, तो definitely proteinuria भी हो सकता है वो patients में. Proteinuria, I told you, excess amount of serum proteins, that is serum albumin, serum globulin in the urine. Then another disorder, that is gout. Gout is a condition wherein there will be accumulation of uric acid crystals in the joints, okay. uric acid इतना बनता है बॉडी में कि वो excrete करने को भी बहुत टाइम लगता है, okay. As I told you, ureotelic organisms में यूरिया is excreted in more quantity as compared to uric acid, बट यहाँ पे क्या होता है, ये पेशेंट्स में यूरिक एसिड भी बहुत ज़्यादा बनता है, and that uric acid cannot be thrown completely at a time through urine. So these uric acid crystals will get accumulated in the joints, okay, and because of which there will be pricking sensation in the joints and inflammation of the joints. Synovial fluid का जो cavity रहता है जहाँ पे synovial fluid accumulate होता है, वहाँ पे भी infection होता है, got it. So accumulation of the uric acid crystals in the joints because of more production of uric acid. यूरिक एसिड क्यों एक्सेस में बनने लगता है, बिकॉज ऑफ एक्सेस मेटाबॉलिज्म ऑफ प्यूराइंस that is adenine and guanine. Got it? That is about gout. Now renal failure. Renal failure में there are two types of renal failure. Renal is a word for kidney. So renal failure or kidney failure, you can say anyways. Or renal failure can be of two types: acute renal failure and another one is chronic renal failure. Okay, acute renal failure, acute means sudden, there is sudden damage to the kidney. Okay, injury to the kidney, कुछ accident हो गया तो kidney जहाँ पे located है वहाँ पे उसको injury हो गया, there is inflammation of the kidney, infection of the kidney, okay, kidney stones हो गया, उसकी वजह से immediately there is malfunctioning of the kidney. Then you will say which type of failure it is? Acute renal failure, sudden, immediate, okay. And chronic renal failure means धीरे धीरे किडनी का फंक्शन कम होते जा रहा है. Got it? It takes several months as well as years for malfunctioning of the kidney. Okay, acute में sudden damage to the kidney because of which there is sudden malfunctioning of the kidney. Okay, so acute, chronic, two types of renal failure. And what is the reason behind the renal failure? अगर किडनी को एफिशिएंटली फिल्ट्रेशन का काम करना है तो उसको न्यूट्रिएंट्स की ज़रूरत है, ऑक्सीजन की ज़रूरत है, विच इट एक्वायर्स थ्रू ब्लड कमिंग फ्रॉम द हार्ट थ्रू रीनल आर्टरी. गॉट इट? सो रीनल आर्टरी में जो ब्लड आ रहा है किडनी के पास, इफ़ द वॉल्यूम ऑफ द ब्लड इज़ less, definitely the oxygen and nutrients available for efficient functioning of the nephrons present in the kidney will be less. Okay, so less availability of oxygen and nutrients due to less supply of blood to the kidney. Okay, so kidney को कम quantity में blood आ रहा है, blood मिल रहा है, so definitely less volume of blood will be available for each and every nephron. नेफ्रॉन को ब्लड का न्यूट्रिएंट्स एंड ऑक्सीजन कहाँ से मिलता है? एफरेंट आर्टेरियोल. when it enters, it divides and redivides into glomerular blood capillaries, then efferent arteriole comes out and it surrounds the nephron, it divides and redivides into peritubular capillaries. Efferent arteriole divide होता है peritubular capillaries में and these peritubular capillaries surround the nephron. Got it? So nephron will also ultimately receive less volume of blood because less volume of blood is entering in the kidney through renal artery, and this will lead to renal failure, either acute renal failure or chronic renal failure. Acute, sudden malfunctioning of the kidney, that is acute renal failure, and if many months or else years are needed for malfunctioning of the kidney, बहुत मंथ्स के बाद नहीं तो बहुत ईयर्स के बाद किडनी का माल फंक्शनिंग हो रहा है, मीन्स देर इज प्रोग्रेसिव माल फंक्शनिंग ऑफ द किडनी, देन सच टाइप ऑफ फेल्यूर इज chronic renal failure. Then next disorder is anuria. Anuria, and here means absent. Okay, means you cannot say altogether zero, there is no excretion of the urine. There is excretion of the urine, okay, there is release of the urine, but very less amount of urine will be excreted out. How much? 50 to 100 ml of urine will be excreted out per day. 50 to 100 ml of urine. So very less amount of urine will be excreted out in anuria condition. Okay. Then we will talk about uremia. Uremia, name itself suggests. What will be more in concentration in blood? Urea. Okay. I told you urea is present to some extent in the blood for maintaining osmotic concentration of blood as well as to maintain constant osmotic pressure of blood. Okay. But if this urea concentration increases than the normal range, then definitely that person will suffer from uremia. Okay. Normal range of the urea which has to be present in the blood is 0.01% to 0.03%. Okay. And if the level of urea exceeds more than 0.05% in the blood, then that person will suffer from uremia. Okay. Then next disorder is cystitis. Okay. Cystitis is the condition wherein there is inflammation of urinary bladder. Okay. Urinary bladder का inflammation होने के कारण that micturition reflex is not proper, and it may happen that whatever voluntary urethral sphincter will also get affected and person may urinate at any time. Fine, due to inflammation of the urinary bladder. So proper contraction relaxation नहीं होगा detrusor muscles का, and it will affect the urination. Fine. So this is all about cystitis. Then pyelonephritis. Okay, pyelonephritis में क्या होता है? There is inflammation of the renal pelvis. Renal pelvis is the large cavity which is present in the kidney. वहाँ पे पहले यूरिन accumulate होता है किडनी में, and then the urine enters in the ureter. Okay, so अगर renal pelvis का inflammation हो गया तो जगह कम मिलेगा यूरिन के accumulation को, and it is going to affect the excretion of the urine. So amount of urine excreted will also decrease here. Okay, in pyelonephritis. Then another one is glomerulonephritis. Glomerulonephritis is also known as bride's disease. Okay, got it? ग्लोमेरुलोनेफ्राइटिस में क्या होता है? इन्फ्लेमेशन ऑफ द नेफ्रॉन, सेम एज दैट ऑफ नेफ्राइटिस. ग्लोमेरुलोनेफ्राइटिस में स्पेशली देर इज much more inflammation of glomerulus as compared to inflammation of tubules of nephron. Simply nephritis में various places of the nephron may get inflamed, but glomerulus का इतना ज़्यादा inflammation नहीं रहता है जितना कि glomerulonephritis में होता है. In glomerulonephritis there is much more inflammation of glomerulus, which will lead to proteinuria, hematuria, hemoglobinuria, okay, and oligouria also. समझ में आया? Oligo means less amount of urea present in the urine. So glomerulonephritis, all of you understood what is that? Inflammation of the nephron wherein the glomerulus part of the nephron gets much more inflamed. Okay, so we have completed here disorders of kidney. In that, diabetes insipidus, which is caused due to deficiency of antidiuretic hormone. Then nephritis is a condition wherein the inflammation occurs in the various places of the nephron, which leads to albuminuria, proteinuria. Gout, inflammation of the joints due to accumulation of uric acid crystals. Renal failure are of two types: acute renal failure, sudden damage to the kidney because of which kidney functions will be affected. There will be less blood supply to the kidney through renal artery, due to which there will be less blood supply to the nephron through afferent arteriole. Chronic renal failure, years or months लगते हैं chronic renal for malfunctioning of the kidney. Okay, that is chronic renal failure, means धीरे धीरे there is deterioration of the kidney. Then anuria, anuria में क्या होता है? Less amount of urine is released out from the urinary tract. Almost how much? 50 to 100 ml of urine per day. Then uremia, in which if the urea content in the blood increases and if it exceeds 0.05%, then urea will be excreted in large quantity in the urine. Then cystitis, that is inflammation of urinary bladder. Then pylonephritis, pylonephritis में क्या होता है? Sorry, pylonephritis it is inflammation of renal pelvis, because of which the volume of urine excreted out will decrease as space for accumulation of urine in the kidney is less. Glomerulonephritis, inflammation of the nephron, especially glomerulus region of the nephron gets more inflamed. Okay, so that is all about disorders of kidney. Thank you.